Forget it. We'll chop off the early bit. So let me try and get
ये पार्टी क्या हाँ ये वो पे तो नहीं हार्ड नहीं कैसे पार्टी किया
somebody's mic is on.
तेरा बुकवा तो नहीं पा रही हूँ
Okay. Okay. Speakers, participants, list. I think we have got quite a few people. So we're going to record this and hopefully other people, I received quite a few apologies, so we'll kind of work around it. Yeah. So it's 6 o'clock. I think it's time to start. Welcome, everyone. It is amazing to see how the concept of working together, the modern medicine with the alternative and complementary medicine has worked so far. And I think it is a good start of a new journey. This journey that I and many of you have been undertaking over past 10 years in order to get the gaps in the modern medicine being filled by the alternative and complementary medicine. We all know that there is a system and each system is not perfect. One system has some benefits, the other system has some other benefit. With best will in the world, the modern medicine or Western medicine or allopathy as it is called is most widely used and most relied form of medicine. And that does not mean that it has got the cure for everything. The integration of alternative and complementary medicine, ACM as it is called, is quite vital. If you have acute and emergency problems, then you need to take the benefit of the evidence-based medicine that is available within the Western medicine or modern medicine. On the other hand, if you need help with the chronic problems, chronic illnesses, mental health problems, preventive illnesses, and more importantly, personalized medicine, which the world is now moving into, we need to see the other form or disciplines of medicine. And if we can pull these all together, and we know that there are some of these traditional medicines that have existed for thousands of years, including like Indian traditional medicine, yoga and Ayurveda, 3,000 to 5,000 year old. Same is traditional Chinese medicine, the Tai Chi, Qigong, acupuncture. They have been there for a long time, and each of them have some evidence which over past 8 or 10 years, I have actually worked and done a lot of research to find out that there is a solid mechanism for it. And therefore, it's important that we work together in order to get the best benefit of it. So with those introductory words, I would want to see many of you taking this concept forward. Can I request all people to keep the mics mute until they have been given a signal to speak? And also, can all people be gentle and kind to the speaker and not to be seen or to be recorded? You have the opportunity, although we would love to see your face, we would love to see the interaction. It is going to be a session where we want to bring the best benefit to you so that you can take the tools and techniques, and you will see Jane Silver in a few minutes, how she has crystallized her experience of 10, 12 years, probably 2 decades in different areas. And today's topic is something very, very topical, and I'll come back to it, which is eating disorder. And that is very, very common in modern medicine. There's very limit. I do pediatrics in my day-to-day life, and anorexia is so common. RFID is becoming more and more diagnosed with no help, no support. Even the child and adolescent mental health services deny providing any support. So here we will find some tools and techniques that we can use in our patients or in our personal life, because a lot of these emotional problems which spring from the bottom are the similar structure, and they can cause that. So let's take some of them, use for our friends, family, ourselves, or patients we see, so that we can benefit them. The second thing is also that we would use these selectively into small pieces, so, and you can do the same, so that people who we could not reach or who could not be here, but you think they would benefit, please do reach to us, and we will help sharing the recording with you. Now, before I move further to Jane, we have, so I might just tell about myself. So I'm a consultant pediatrician, but I have interest in the alternative and complementary medicine, and I have done a lot of work, a lot of research over the past 10 years in how we can connect the modern medicine with yoga, Ayurveda, acupuncture, acupressure, hypnotherapy, dance therapy, music therapy, homeopathy, Reiki, energy therapy. All these have got some distinct advantage, and these all are tools in the toolbox, as I say. When you need a screwdriver, the hammer wouldn't work. And when you need a spanner, the screwdriver wouldn't work. So these are all tools in the toolbox we can pull out to help the patient. And at the same time, the patient is empowered to use different tools and techniques, because not the same tool will work every time. So if we can empower our patients and empower ourselves by learning this integrated medicine, which means connecting everything together, and we have got a community so people can talk together. We have now educational program and modules through Health Practitioners Academy, which we will tell you a little bit later, maybe end of this session or in the next session. We will run these sessions every 2 weeks, 6 to 7 p.m. UK time, and people can join it. We are not restricting it at this point in time, but depending on how it plans out, there are different topics. Today's topic is more based on the emotional problem, eating disorder, anorexia, bulimia, RFID, orthorexia, and many other things. And we will talk a little bit more about the neurobiological basis, neurochemical basis. It's all a scientific talk, but also bolted on it are the practical aspects, which we'll do. So that's first part. Second is I have with me my inspiration and one of very senior professor, Ramesh Gupta, who has been he has stimulated me to do all that work, which I have done for years. Like, daytime job is 9 to 5, but like 7 to 12 o'clock, 2 o'clock in night is this extra work, digging it out, creating the website, creating the content, creating the modules, creating the library, and creating a platform. We have got nearly 40 ambassadors who believe that working together is important, and they're going to work. And we're going to expand this network. So if you know anybody who's suitable to be ambassador, they have to have some checks, and also they need to declare their interest, and they need to really play importance on the basis of science or the philosophy rather than themselves. So with that, let me invite Professor Ramesh Gupta. Do you want to tell how do you feel about it and how it works? And then we'll bring Jane in around 7 minutes.
Thank you very much, Rajiv, for your kind introduction. You are a man with a vision, and you're hardworking, and you have brought all these things together. I think one should not forget that the resources within the NHS are limited. They are never going to be enough to fulfill the demands put on it. The best way of managing the health and health services is to reduce the illness. This means, A, we can prevent the illnesses where it is possible. Two, we should use whatever is available to us to treat them or to contain them. And to say that one is inferior to the other or superior to the other will be wrong way of going around. We must not forget, as you already said, that certain treatments and therapies and sciences have been there for thousands of years, and they cannot be wrong. It simply cannot be wrong. And I think the only thing is that they do not fit in with the present mode of evidence-based, so-called. Because the evidence, what they are looking for, that sort of evidence was not required when these therapies came and continued for years. But I think what we can do, I think basically what you have said, grossly fits in. Not necessarily that they don't overcross, they do. But I think this, if we look at the acute illnesses, which you treat for few days, 4 or 5 days, do some operation, the allopathic, the modern medicine is good. But where you want to continue the therapy and treatment for months and years, I don't believe that that is the good way, because of simply their side effects and unknown things which we do not know, because we hear all the time that this drug was wonderful, only to know after 10 years, oh gosh, this causes this. This has been discontinued. Because they have been tried and started very quickly. And there's no way to delay it because we needed them now. So I think that is one. Two, if we look at the chronic illnesses, you take the chronic chest problems, breathing problems, you take the chronic aches and pains, you take mental health illnesses, you cannot really say with your hand on your heart that the modern medicine is doing much good to you, to be honest. They give the symptomatic therapy, they continue, and then in the last they will say, which we say in the beginning, you will have to live with it. We say in the beginning, it's your lifestyle. It's a living style we need to change and hammer on from the beginning so that the illnesses don't come. And sometimes both together are very good. Example is simple. People are living very long these days with cancer. And this is due to the advancement of modern therapies. But the side effects and the quality of life during their last few years is miserable, not good. If you combine that with the other therapies, maybe whatever is mindfulness, whether it is yoga, whether it is hypnotherapy, they reduce the side effects, they calm you down, you feel better, and you are coping better with the therapy. And I think that is where concentration should be. Our concentration should be, is the people feeling better? Do they want to really live with that style? Or are they just coping about and are they miserable? I think that is the choice which we have to make. And it is very clear that because of the lack of so-called evidence-based, the other therapies are not used, which have got very good thing. Like if you take the illness in elderly, what do they suffer from? What do they die of? They die of falls. They die of lack of balance. But if you do regular Tai Chi, regular yoga, regular breathing exercises, regular walking, exactly lifestyle which the alternative therapies teach you from day one, they will not have a balance problem. And I think it is a question of not superiority or inferiority. It is not a question of this or that. It is we must learn to combine and give the what it suits to a particular patient in a particular condition, which make them better.
Wonderful. That's so
And the
good.
other thing, I must finish with that I think you and me have been working and we have a National Forum for Health and Well-being. The whole concept is empowering, which you said, is a very powerful word. We are empowering the communities so that they can cope and they can live healthy lifestyle. And this can only be done with education so that they know it. 2, signposting. If they need help, where they can get best and quickly. And both these things, what you are doing today, can be achieved through these series of lectures. So wonderful job. Well done. Congratulations.
Thank you so much. It's so humbling and empowering to hear you have so many years of experience. And for people who are in the audience, Professor Rumesh Gupta has been a consultant physician in this country for decades, and for past more than 2 decades, 2.5 decades, he has been chairman of this charity called NFHW, or National Forum for Health and Well-being, doing the Health Mela events, free service to the community, doing the health checks, and probably we'll talk on some other occasion a little bit more. But it's an immense work, and the concept of the NFW is to bring together an holistic medicine, holistic health, connecting people to the science and connecting science back to people so that maximum benefit goes. So thank you very much. Let me bring Jane. I know Jane for nearly 6-7 years now. She is amazing person. She is by background a psycho-hypnotherapist and a brain health consultant. And for those people who would want to know a little bit more, her interest is trauma, stress, anxiety management, and disorder eating pattern. And this, we know that emotional dysregulation is the main cause of anorexia, which is not very well recognized in our Western medicine. And the second thing is, in addition to that, there is also unconscious conflict in the brain, and therefore the image versus the fact is disconnected. And quite often the Western medical science actually goes sometimes using CBT, but in terms of giving calorie supplement or things which bypass the original mechanism. And here, hopefully today, Jane will, with her expertise in therapy, in terms of resource management, in terms of using the internal resources, and what questions to ask and what tools can be used through evolving toolbox, which can not only be used in patients, but also in our personal life, including neuro-linguistic programming, acceptance and commitment therapy, emotional freedom techniques, simple tapping actually changes the mind, and some mindful-based techniques for inner repatterning is amazing. She's superb, and I would want to bring her in before anything else happens. So let's give a big round of applause and welcome to Jane. Abhi, can we highlight Jane? So Jane, the floor is open to you. Please give us some benefit of what it is from your point of view, what these conflicts are, and how this dysregulated eating behaviors and the emotional comorbidities which are bundled with it can be untangled, and the self-esteem issues and the emotional trauma, which quite often compounded, can be teased out for improved body image, reduce anxiety, and the depression that goes with it. Over to you, Jane.
Thank you so much for having me. It's a privilege and a pleasure to be here with you all. I thank you for that lovely introduction. I am an integrated hypnopsychotherapist, NHS trained, and I quickly learned that one size fits all programs is not going to work for the individual clients that I see on a regular basis. So there was no one therapy that suited everybody. We were trained in talking therapies and CBT, and then I went on a bit of a journey doing NLP. So I did a master's. And actually what I realized very quickly was that CBT, which happened to be the first line NHS therapy for lots of things, actually is not the relevant therapy for trauma. It's scarily bad for trauma, yet that's usually the first line that GPs and other medical professionals refer their patients to, because that's what is classically understood to be the best therapy. What CBT does actually is it takes people further into that trauma response, which is already either frozen in fight or flight, and we need to build trust before we can get into any of those relevant therapies. So as Rajiv has said, I specialise in trauma, in disordered eating patterns, including anorexia, orthorexia, ARFID, polyphagia, pica, bulimia. In fact, a whole range of them. You'll have heard of some of them. You may not have heard of some of the others. Avoidant and restrictive eating patterns. ARFID is becoming much more relevant. And the classic sign for ARFID, a lot of people understand that to be picky eaters, or may have been referred to picky eaters, but actually it's very much on the neurodivergent scale. So any child with ADHD, autism, any of those frequencies of neurodivergent brains are actually much more susceptible to ARFID than any of the other eating disorders. And that's because that's to do with sensitivity and texture. It's nothing to do with the food necessarily itself, but it's much more to do with the texture and feel of the food. And sometimes even colour can play a part in that. So lots of children might only eat beige looking food, what I call beige looking food. So they may only eat sort of that has no colour to it. No like pasta cheese, no tomato sauce, nothing like that. And they might only eat bread and butter and carbohydrates. They won't eat vegetables or anything like that. Sorry. Anorexia, for those of you will probably have heard of anorexia nervosa, is all around body disturbance, actually. And whether somebody is gaining weight or have that connection to feeling that they want to be very, very thin, and where they've got that from is usually connected to an emotional overload. So the emotions play part in all of these eating disorders, and we need to be really aware of what those emotions are and how they connect into food. So when I'm working with anybody with a disordered eating problem, I would never really mention food. And that might sound a bit bizarre, but it's a bit like looking at everything. You've seen the timers that turn upside down, like the sound timers. And essentially what I'm doing is, instead of working in a specific way with how most people think they should work with brains, is to focus in on what they're feeling and what they're thinking and what they're understanding by their problem. But actually, we don't necessarily need to talk about it. We can do it through what I call the underground system. So I turn it all on its head, and I work with the emotional load. So the emotional load might look like somebody trying to control something. But if we put a child, for argument's sake, into a psychiatric ward and put them on a drip, then the trust and the control is the problem, because they can't control it because the control's been taken away from them again, and they can't trust the person that's doing it. And then that causes family disconnection as well as disconnection from themselves. So we need to be aware that eating disorders are not just for the person themselves. It affects everybody. It affects the teachers, it affects the schooling, it affects the families, it affects the siblings, it affects every single person around them. Because once they lose the control that they think they've got, they lose it again for the second time when they're hospitalized, and that then puts the lack of trust back in everything, in their system, in who they are as people. It's then it's basically denying themselves nourishment, which is what the eating disorder's underlying problem is. Why do they not deserve to be nourished? What are they denying? Why do they feel like they're denying themselves nourishment? Where have they learned that food is bad for them? What are they frightened of? What are the fears that sit? Is the trauma or childhood unhappiness there? Have they been bullied? Is there any painful memory that's stuck in there or frozen in the nervous system that we need to release before we can even discuss why they're not eating? So we don't, in that first few days or weeks of seeing somebody, it's all about building trust. But if they can't trust the system, then they're going to be feeling out of control. So it's about putting them back in control of their own problem. There's often connection to not thinking themselves good enough, or they receiving love, or critical of themselves. Criticism forms a part in many of the eating disorders. Self-critical, very self-critical, the inner child wounded often because of bullying, and the bullying doesn't necessarily need to be long-standing bullying. It can be some throwaway comment that somebody makes, simple comment, oh, you look fat in that, or something that they've seen on social media where their size 00 is the new fad. Whatever that is, they don't understand the consequences, especially the young ones. And I've seen kids as young as 8 with these disorders. And unfortunately, modern medicine doesn't have all the answers, which is why I went on this journey of, okay, so how can I help these young people to support them through this traumatic disorder? Because that's exactly what it is. It's they feel unsafe. They're not getting their basic needs being met. You only need to look into the psychology of Maslow and see that in every single stage of Maslow, they are not meeting their needs. So the baseline is their basic needs aren't being met: food, water, nutrition. They don't feel stable, they don't feel secure, they feel on edge, they feel scared, they're worried. They don't feel secure, they feel insecure in their own bodies, in their own heads, in their own minds. They don't feel like they belong anywhere because their best mates are doing just fine and they're on the edge of all of that. They then have no self-esteem, no confidence, no self-worth. And they cannot be the best versions of themselves because they're being totally misunderstood, either by not being heard or not being listened to, or by, and through no fault of their own, parental control trying to take over, or, you know, doctors trying to drip feed them because they're in medical danger. But they need to feel very much in control of the situation. So trust is the most important thing that we can instill. They all are in fight, flight, freeze mode. So from a layperson's view, they're dysregulated. They're just the nervous system is shut down. It's not online. It's disconnected, and it can be disconnected for a whole variety of reasons. In fact, I worked with a young girl who was diagnosed with anorexia. She was hospitalized twice. First time, nothing worked. The second time, she was so fearful that she had prepared herself to die. She had actually prepared herself to die. Her mum called me in desperation. She got my name from, I'm not sure where, but a colleague or somebody who I was working with. And she said, I don't know if you can help me, but my daughter is preparing to die. She's 9 years old. And I'd really like it. I'd like to book an appointment to come and see you. And I saw her. And the first thing I said to her was, like, can you draw on a piece of paper how you, like, what's going on? Just draw me a picture. And she drew me a picture. I said, it doesn't have to be fancy. It can be stick figures. It can be whatever colors you like. Just draw me a picture of what you think's going on. And she drew herself up in the top corner of a piece of paper, and everybody else was down here in this side of the piece of paper. Her mum, her dad, her siblings, her school friends, her teachers, everybody was here, and she was up here. But that picture told me a lot. That picture told me that she was alienated, that she was alone, that she was sad, that she was not having the answers to anything that she could work out. And I said to her, when did you start feeling like you were up here? Rather than in this bit here, when did you move yourself up here? And she said, her response was, since I got a neurovirus bug in school and a little boy laughed at me. And I said, why did he laugh? And she said, because I was sick. But I'd eaten, and then she said, but I'd eaten cottage pie at school, and that was what made me sick. So she'd automatically connected the food to sick. And when we worked a little deeper using art and colours and shapes and things not really related to food at all, we discovered that actually what she had was a metaphobia. It was a phobia of sickness that she'd linked to food, and her mum was completely like blown away, because her mum was obviously in the therapy session with her, and she said, you mean this isn't anorexia? And I said, well, the anorexia is what's happened to her body, but actually the root is not in anorexia. The root is in the fear and the phobia of emetophobia. And we worked over the few weeks to clear the emetophobia, to clear the phobia. And I used neurolinguistic programming, I used hypnotherapy, I used tapping techniques that I taught her to use for herself. So she then had the control back within her own power. She had the techniques that she could use for herself whenever she was feeling out of sorts, whenever she was feeling like she didn't want to eat. She used the tapping to help her to put herself back in control. There has been some medical evidence around tapping, emotional freedom technique, that reduces cortisol by up to 25% in that very first session. There has been research, scientific research done on that particular therapy, and we get really amazing results with it. And unfortunately, most therapists under the NHS system don't have it under their belt. It's not a regular therapy that we're taught as NHS therapists. So you have to go and do that as a separate CPD course or learn it for yourself. I taught her how to do this. And at the end of about 4 weeks, she drew me another picture. But this time her picture was her in the family. And then over time, we worked to release the blockages that were stuck within the system. So we defrosted, if you like, some of the frozen trauma somatically, using somatic techniques, using techniques of shapes and colours and what that feels like within. And it's a technique called mindfulness-based inner repatterning, which is an energy-based technique, which is amazing for trauma, because we don't need to realign them with trauma. We need to take them, we don't need to revisit the trauma. We need to move them or like realign them in a different way. And we do that using techniques that take them away from the trauma or the mental state of trauma. Because unfortunately, when you're traumatized for whatever reason, whether that's with an eating disorder or whether you've had a really bad experience, whether trauma is real to somebody and not real to somebody else, it doesn't matter, because the brain obviously doesn't know what's real, what's imagined or perceived, and we're living in the story that we told ourselves. So if we're telling ourselves a story that we've got X, Y, or Z, then that's the belief system and the programming that's connected. But I also like to, especially when I'm working with young people who are very tech savvy, is I like to say, okay, if your brain is an iPhone and your gut and your nervous system is like a Samsung and they're not speaking to each other, then how can we reconnect them? How would you reconnect them? Again, that's putting them back in control of their whole nervous system without actually having to say anything. It's about giving them the tools and the respect and the understanding that you're coming to them at their level. It's not about trying to be up here and them trying to be there. It's about meeting them where they are in that particular moment. And that little girl was preparing to die. But in 4 short weeks, she was back online. And it was when she was back online, I was then able to go in and reprogram all of that stuff using hypnotherapy, using visualization techniques, using NLP, using belief coding or the emotion code that was written by Dr. Bradley Nelson, Peter Levine's stuff on somatic work and body keeps the score. And all of these techniques are scientifically proven to really work and really help. And it's about reconnecting all the educational systems. Actually, it's in every educational system. We need to reconnect people to themselves because quite a lot of them are now disconnected. We reckon something like, we were at a conference the other week, and we reckon something like 75% of the population are actually disconnected from their own selves. And that's scary to think that people are walking around, living in their heads, not able to connect to feelings or to emotions. They don't know how to do that. They don't know how to reconnect. They don't know how they feel. They have no clue. They're frozen or in fight, flight, and they're not socially engaging. And I think COVID had a lot to do with that disconnection. People disconnected. We have a lot of kids who are not going to school. They're being homeschooled. They're not socially engaging. They're just living day to day. Majority of them terribly terrified or not connected.
Jane, would you kind of expand on the tools like EFT, somatic technique?
Yeah, sure.
Micro.
Yeah, sure.
So people can take it. Sorry.
Yeah. So I don't know if any of you are aware of what emotional freedom technique is, but I'm just going to show you the basic tapping points of where I would tap and what how that then reacts into the body. But you can maybe tap along and see if you're noticing any sensations as you're doing it, or notice where your heart rate, how your heart rate changes, or notice any thoughts that are going around in your head, and maybe feel how that feels for you. And the second exercise I'm going to teach you or show you is something called mindfulness-based inner repatterning, which I find absolutely phenomenal. It's really easy, it's really quick, and we don't have to discuss anything. We just use shapes and colours to release what the blockages may or may not be. So I'm just going to show you very quickly, and then you can take what you like. The first point is in the base of your hand here. There's a bone, and we just tap with it with 3 fingers, just like this, and we just breathe. Just notice nothing but any sensations and feelings that you feel within as you're doing this. And some people notice lots and some people notice nothing. There is no right or wrong to this process. The next points are in your fingertips. So we just tap here. And I always tell the kids that they can do it under the desk at school if they're anxious and nobody even knows what they're doing. Then you just take a big deep breath in and exhale that out. And the next point is actually where the amygdala sits. It's the third eye position of where the eyebrows meet the bridge of the nose. And we just tap here. Take a breath, breathing in and exhaling out, in through the nose and out through the mouth, and then you come out to the side. Now, interestingly, when people are stressed, you see them automatically doing this. It's quite common that people do this or this when they've got a lot going on in their heads. It's a body language that is very commonly used. But if we tap, instead of doing that, we're releasing the stress and the pressure from within. Take a big deep breath in and exhale that out. And then we come underneath to the where the bone underneath the eyes, and this is all linked to sinuses, so it's really good for things like hay fever or respiratory stuff, sinuses. And somebody once told me it was really good for wrinkles too, so I keep practicing. So we tap here underneath the eyes and we breathe. And the next point here is here. This is linked to the jawline, all around the jaw. So if people have TMJ and problems with the jaw, it's quite a good point to tap on here. And then the next point's in the chin. It's effectively like a back to front question mark. And then the next point here is in the immune system at the thymus gland here, thymus point. And then come out to the armpit, which is actually in Chinese medicine, your lung meridian. If you tap here and then you breathe, you notice your breath is actually deeper than it was before. There's more space. And then we cross over our arms and tap underneath the underneath the armpits, which is where your lymphatic drainage points are. And then if we tap on the top of the head as the final point, and we can imagine steaming out, or imagine a kettle that's boiling, and any pressure that we don't want to hold on to can be released through the top of the head. And we can use visualizations at any of those points. That's just the basic tapping round. And that medically and scientifically has been proven to release cortisol within the system by 25%. That's a lot, just by doing that. The next technique, mindfulness-based inner repatterning, is a technique that I use a lot. It's about setting an intention. So if we set an intention that we want to feel inner peace, for argument's sake, we don't want to have all of that stress and all of that noise within us. If we set the intention that we want to have inner peace, we set that intention. And then we basically go into, and we can use this for pain, we can use this for any feeling, any emotion, we can use it for any painful situation, any tension that we have in our back or in our necks. And in fact, I was working with somebody earlier today who had terrible pain in her ribs. And I just did this particular exercise for no more than 5 minutes. And at the end of the 5 minutes, the pain in her ribs had gone. Just gone. She was completely blown away by how quickly it worked. And it was an emotion that was stuck, essentially. It was a block. So how we work with that is that we find or pinpoint the emotional load or the pain or the tension that we have within us. And just let's, for argument's sake, we have like aches in the backs of our shoulders, in the neck. Lots of people have that from computer work, sitting at a desk, things like that. If you focus in on that particular area, don't judge it or criticize it, just focus in on it. Allow it and accept it to be there without any judgment or any criticism. And then we draw numbers around it to get essentially a shape. So we're doing like an old-fashioned dot to dot. So if, for instance, it starts in the nape of the neck and comes out towards the shoulders, you may have a triangle. You may have an oblong. You may have a circle. It may be an irregular shape. It doesn't actually matter what the shape is. We ask people to acknowledge that, accept that that shape is there, and then we ask them to put a colour to it. Why do we use colour? Because colour bypasses the cognitive side of the brain that is engaged in resistance. And we never engage with resistance. We always bypass it. So by working like this, you don't need to go into the story. The story is relayed in the colours and the shapes. So tinnitus, yes, tinnitus is something that I have worked with, and we turned down the noise rather than turned it off, because the client that I was working with had war trauma, and she didn't want to switch it off completely because it was too silent, and she needed to know that it was there because it was actually a comfort to her. But tinnitus usually comes from some form of loud noise, or some form of trauma, or some form of, there's something that's happened in the emotional regulation, and that's like a warning sign. It's an alarm bell. And yes, Reiki, somebody put Reiki as well before. Yeah, Reiki, I'm also a Reiki practitioner, so Reiki can also help with all of this. But going back to this mindfulness stuff, so somebody comes out and they've maybe drawn a triangle, and the triangle may have been in, I don't know, green or red or yellow or whatever the colour is. It doesn't actually matter. But the colours all mean something. Yes, Rajiv? Sorry, I can't hear you. I can't hear you. For some reason, I can't hear what Rajiv is saying. Can you all hear me?
Yes.
Okay, cool. I thought I was talking to myself for a minute then.
No, we can hear you very well. I think
okay.
he's gone silent somehow.
Okay. Yeah, once we have the shape and a colour, what we do with it then is we take a really big, deep breath in and exhale it out as if we are breathing a purposeful sigh of relief. And then we observe what we've put outside of ourselves. Because then we're not seeing it how it is within us, we are seeing it from an external perspective. And then I may say to the person, does the shape and colour look bigger outside than it feels inside? Or does it feel bigger inside than it looks outside? That tells me whether that's connection or whether it's disconnection, or whether that's part of the fight, flight, freeze, Or with colours, I can often tell because I'm trained in colour therapy too. So what I can do is I can work out what's going on through the colours. So if it's black, for argument's sake, it might be, it's a sign of protection. So it's not ready to leave quite yet. If it's red, for argument's sake, it's about maybe perhaps lack of stability, unsafety, feeling not stable. It's connected into the chakra colors, so the roots, so their roots are destabilized. If it's yellow, it might be connected to their gut health. If it's green, it's connected to their heart health. If it's blue, it's connected to how they voice or how they communicate. But often, mute, people who are mute often have problems with that throat chakra. And it's not connected. For some reason, it's blocked or it's disconnected at some point, usually again from something that's happened where they've not felt safe to speak up or stand up for themselves. So we can tell a lot from colours, and similarly, we can tell a lot from shapes. So circles might be people going round in circles and not being able to get out of their problems. A triangle might be connected to the drama triangle in psychology of Stephen Cartman's playing victim, perpetrator, hero to their own story. And they're stuck within that.
Fantastic. I'm just conscious of time. Sorry. So if there are last message you can give, and then we may take one two small questions, and then we'll plan to finish at 6, 7, 8. Okay? Can you hear me?
Yes, I can hear you.
Fantastic. So do you want to wind up and give a kind of message?
The message here is that it doesn't matter what the therapy is. It doesn't matter what the medical interventions are. It doesn't matter if it's placebo or not. What matters is the patient that you have in front of you and building up the rapport and trust that can then get them on side in order that you can make a difference. And it is always about patient care. It's never about what is not right. It's about patient care. And we all go into these industries to help and to heal and to and to make a difference. And if we can make a difference together, then we're on to a winner. If we separate it all out and disconnect ourselves, disconnect medicine from therapy or therapy from medicine, because neither of us are trained the same way. None of us are trained the same way. We're all trained differently, but it's what we bring to the table to help our patients to feel better is what matters.
Fantastic. There's a question. What does once the shape is formed and the color is done, what difference does it make?
It basically really it softens the trauma, and the more you do it, the softer the trauma moves. It moves through the body, so it then feels safe to release it. So we're releasing it through the body, through shapes and colors. We don't actually need the story if the patient's not ready to tell the story.
It's fantastic. I don't see if we may have one more question if anybody has. Otherwise, I think we can bring. Manisha has a question, I think.
Hello, Jane. Thank you.
Hi, Manisha.
Hi. Thank you for that lovely presentation and information what you have shared. I just have one small question regarding the shape or which you are going to trying to throw out with your exhale. So the
Yeah.
shape of the size of that shape. If the shape within you feel is smaller than
Yeah.
the one which you have exhaled, does it mean that whatever you were holding, you are trying to push it out, or the
Yes.
other way around?
No, when you're holding a shape and you put it outside of yourself on an imagined whiteboard or mirror, and you look at it, you are then seeing the shape that was inside of you, outside of you. So you're pushing, you're releasing whatever that feeling is outside of you. But then they look at it. They can observe it from a distance. And you can say, what does it look like? What does that look like? How does that look to you? And they might say, oh, it's bigger outside or smaller inside. But then you just say to them, leave it outside. That's okay. Leave it outside. Just observe it. Don't judge or criticize it. Just observe it. Leave it outside and then go back inside to your internal awareness and check in on those numbers. Is it still the same shape, or is the shape changed? Has it moved? Is it different? What does it feel like to you now? And often, even after 2 or 3 goes of that, the shape has either gone completely or it's reduced or changed, like to a completely different color or a different shape. And today I worked on somebody, and she had to start off with, she had a red triangle that was as big as her. And then she did it again, and the triangle changed to green and was smaller. And then she changed it again, and this time there was no triangles there. There was a figure. She saw a figure, and it was the figure of herself that she put outside of herself. And it's at that point that we can work with the wounded inner child.
Lovely. Thank you so much. Thank you.
Okay. I hope that helps.
Absolutely. Yes, it is helping now. Thank you.
Amazing. I am conscious it's 7 o'clock, and we want to kind of keep it to time because people have, functions to attend, or children, or food, or whatever. So I think let's all give a big round of applause to Jane for the amazing talk, the whole system in simple, easy chunks, and giving us tools to do.
Can I just say, Rajiv, can you hear me?
Please. Yes, we can hear you, please.
I think it was a wonderful talk and so much to learn. But what worries me that are we really missing these eating disorders in adults and elderly people? And we take it for granted because of age, they are not able to eat, or because they may be having some underlying organic cause or loss of appetite, and they go battery of tests and investigations taking to nowhere. And I think that there may be something which is there of the similar nature. Maybe we will have to give some different name, but I think there is some thing of this kind. Have you come across?
Yes, I work with eating disorders with everybody, but child, adults, varying different age groups, some elderly people who have been struggling with eating disorders for their whole life, but they've managing it in the way that they've been told how to manage it. They never realized what all the connections were to the emotional loads and the backstories and the interesting journeys that they've taken have led them to the space that they're in. So yeah, we can work with adults and children in exactly the same way. But with children, it's a little bit, we have to work softer. We have to be much more on their level. We have to use, and I think I worked with a little boy the other day who had ARFID. I used a magic wand, an imagined magic wand, and I took him into a visualization of who he, the person that he trusted the most. And he was loads better after that particular session. But you have to just go on to their level. It's all about trust. It's all about gaining their trust, especially with trauma and eating disorders. They have to understand that you can help them. and they've hit so many brick walls over the time, again and again and again, that they lose trust in the processes, they lose trust in the systems, they lose trust in who essentially should be trying to help them, and the people that essentially they think should be helping them are often making it worse, not because they want to, but because they don't know how to respond or react to that.
Thank you.
So can I ask a
Amazing.
question?
You're kind of running out of time. If it's a short one.
Oh, I just wanted to know, do you know there's like EFT and all of these therapies is not recognized in NHS. So how can we use it? Because I have done a course on EFT, but I just use it for myself. I'm not able to use it for anybody else because unless I do my own business, I can't use it for patients.
I
How
wish
can
we could align it into the NHS programming, because it would make the biggest difference to preventative care.
Yes, I
So
think that's the whole
how can we do that? Because it is effective. It is very effective. It doesn't take very long. The results are so good that once problem's gone, it's not going to come back.
Amazing. So thank you very much, Hemant. I think that's the whole purpose. Currently, NHS is very systematic, but very linear and boxed approach. And with us working together through integrated health and integrated medicine, we hope that philosophy filters through. We build the evidence and then we'll take it to NHS. And it's cost effective, it's simple, it's powerful. So hopefully we take it in a systematic way and they will accept.
If any of you are interested, I also have a podcast that is about to be released on the 22nd of this month, which is on Tuesday. It's real life case studies of vulnerable people who are going from struggling to strength. And if any of you are interested in speaking, I know Dr. Gupta's going to come and speak on it, but if any of you have an interest in speaking on some of this stuff, I'd love to have you.
Amazing. And I may do an advertisement for BAMA, the British Ayurvedic Medical Association. They are holding podcast on 11th of May, 4:30 to 5:30. So it's again, all of us together make it better. Thank you so much indeed.
That's the aim. To make the patients feel better.
Once again, from bottom of my heart, thank you so much.
Thank you.
Thank you.
Thank you for having me.
Everybody have a safe journey back.
Thank you. Thank you.
Thanks, Rajiv. Thank you. Bye-bye.
Thank you.
Thank you. Thank you.